Nikita. I'm going to be doing a physical exam today, and you are?
Chad.
Hi, it's nice to meet you. I'm going to go ahead and wash my hands. I'm going to get vital signs, blood pressure, pulse, respirations, all are within normal limits. Can you tell me what today is, Chad?
April 30th,
Okay.
2017.
And who's our president?
Donald Trump.
Okay. And where are you at right now?
In my house.
Okay. My patient is A&O times 3. All right, so I'm going to go ahead and get started with your exam today. Is it okay if I touch you? Put my hands? Okay. I'm going to go ahead and start by examining the skin that's exposed right now, looking for any patient has tattoos on his arm. There's no lesions. The skin is warm and dry. Patient has tattoos on both of the arms. All right. Skin is still dry. Any pain or anything in your arms or legs when I touch?
No.
Alright, I'm going to look at my patient's nails. Nails are trimmed and clean. Capillary refill less than 3 seconds on the hands and on the feet. The nails, like I said, they're trimmed, capillary refill less than 3 seconds. They're not convex. They're convex but no clubbing. And we're going to go ahead and examine the head. The head is normal cephalic, has a normal shape, and the scalp is dry, free of any lesions. No, the hair isn't flaking, it's coarse. There's no parasites, anything like that. Go ahead and look at the face. The skin is warm and dry. The skin isn't oily. The patient does have facial hair. And keeps it clean. Go ahead and look at the eyes are in the top third of the face, and the nose is midline. The mouth is in the bottom third of the face. Go ahead and I'm going to look at the patient's ears. All right, normal cerumen present. To look at adult ear, you pull up and back like this to straighten out the ear canal. If I had an otoscope, I would go ahead and look in there, looking at the tympanic membrane, that it is a clear grayish color. So go ahead and look at both of them. Is there any pain or tenderness in your ears?
No.
In here? No? All right, I'm going to feel in here. Is there any pain or tenderness in here?
No.
Or in here?
No.
All right. Good. I'm going to go ahead and look at your eyes. Go ahead and look forward for me. I'm going to lift up on your eyes, okay? Conjunctiva is pink, no exudate. I'm going to look at this eye. Eyelashes go upward. All right, I'm going to press right here. All right, tear ducts are good. There's no, when pressed upon, there's no exudate that come out of those either. Eyebrows, they look good. All right. Let me check the eyes. Go ahead and I'm going to do an eye exam on you, just for eye exam. If you go ahead and look at my finger, I'm going to move it close to you. You just follow my finger as it gets close to your face, okay? Okay, go ahead and look at the wall behind my hand and back at my finger. Okay, accommodation is normal. Go ahead and look at my finger and follow it. All right, no lag when the patient follows my finger. If I had a ophthalmoscope, I would look at, dim the lights. I would look at the eyes, looking at the sclera. It's white. And the pupils were equal, round, and reactive to light. I'm going to check that. Go ahead and look straight ahead for me. I'm going to shine a light in your eye, okay? I'm going to do the same on this side. Pupils are equal, round, and reactive to light. All right, I'm going to feel on the lymph nodes now. All right, I'm going to feel around right here. Tell me if you have any pain or tenderness when I do that, okay? Is there any back here?
No.
Okay. In the occipital area, posterior periocular, the submandibular, any in there?
No.
And superficial and deep cervical, and the supraclavicular. Any?
No.
Okay. No? Okay. Gonna go ahead and look at your mouth. Can you open your mouth for me? Alright, say Alright, tonsils are present with no exudate at a +1, no swelling. The tongue is pink and moist. The hard and soft palates are both intact. The lips are pink and no cracking, nothing like that. The tongue is rough from the, open up, wait, let me see your tongue. Rough from the papillae that's on the tongue, and the ventral surface is smooth and the saliva is present. I'm going to go ahead and listen to your carotid. Let me feel your carotid. Okay. Alright, I'm going to listen in with my stethoscope, okay? Take in a deep breath and hold your breath for me. Alright, let that one out. Alright, do it again. Deep breath in and hold it. Okay, I was listening for any bruits. If you hear bruits with your patient, they could have, it could be an indication of coronary artery disease, narrowing in the arteries that go. Just that indication of that. All right, I'm gonna go ahead and listen to your lungs, okay? Listen to your heart first, actually. All right, just take a deep breath in. And out. Again, in and out. In, out. Deep breath in, out. Again. Okay, one more time. Good, and one more time. The lung sounds are clear to auscultation bilaterally with no adventitious breath sounds. And the skin turgor on the chest is normal. Good elasticity on there. And the chest is transverse diameter wise. There's no pain or anything in your chest when you take deep breaths, is there?
No.
Okay. And then to listen to your heart. Alright, the aortic, which would be in between the second intercostal space on the left sternal border. So, over here on the left side, just go ahead and breathe normal for me, okay? Okay. And then Herb's placing me on the third intercostal space. I'm sorry, no, the aortic was on the right. Okay, and then the Herb's is going to be in the same, but on the left, in the third intercostal space, left border. Your tricuspid is on the fifth intercostal space on the left side. Just breathe normal, there you go. Mitral is going to be the fifth intercostal space, mid-clavicular line, so in here. Okay, and there's a regular rhythm with no extra sounds and no murmurs. I'm going to go ahead and look at my patient's abdomen. And I'm going to go ahead and look and make sure the abdomen has no scars. I don't see any masses. I'm going to go ahead and look first and see no masses. No, you have to pull your checking center now. Then I'm going to go ahead and listen to the 4 quadrants of the stomach for my bowel sounds. Alright, I see no visible peristalsis or pulsations. Bowel sounds are active in all 4 quadrants. I'm going to go ahead and palpate the stomach. Just tell me if you have any pain when I do this, okay? Any pain?
No.
Okay. I'm going to examine the patient's abdomen. In the right upper portion of the abdomen, I'm going to palpate the liver. In the left upper quadrant, the stomach. In the right lower quadrant, the appendix. So if you push down, any rebound tenderness on the appendix would be bad. So we don't want that. And then the left lower quadrant, we have our descending colon. So just push around in there. All right. Okay, I'm going to go ahead and finish examining the skin and the arms and the legs and all. I'm going to check pulses. So go ahead and give me both of your hands. Feeling the radial pulse. Rate is normal. About a +2 or 2+. There's no edema in the patient's hands, and feel brachial pulse. Just go ahead and raise your arm up like this, kind of like more like that. Okay, right and normal. Okay. Feeling the dorsalis pedis pulse on the tops of the foot. Rate is also normal. There's no swelling in the feet. Feeling the posterior tibial pulse. Rate normal. +2 as well. There. And the capillary refill on the foot is also less than 3 seconds. All right. Do you have any questions?
No.
All right. Thank you.